Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
Carpal tunnel syndrome is a painful condition of the hand and fingers, and many sufferers believe that carpal tunnel surgery is their only answer. But as we'll see in a moment, it's not. The most commonly asked questions by sufferers are what actually causes carpal tunnel syndrome, and what does carpal tunnel surgery cost? Let's first understand what causes it. Carpal tunnel syndrome is actually a disease that begins deep inside the wrist in an area known as the carpal tunnel. Inside the carpal tunnel, your flexor tendons, here shown in white, are very close to the median nerve, here shown in yellow. The tendons are surrounded by a fluid-filled sheath, here shown in blue. Under certain conditions, like rapid hand movement, that sheath begins to swell and it pushes against the median nerve. And that causes all of the symptoms of carpal tunnel syndrome. Therefore, for any remedy to be effective and lasting, it must solve the problem of swelling inside your carpal tunnel, and not just mask the pain it causes. Now let's look at the costs of carpal tunnel surgery. Most agree that there are two types of costs. One are the direct financial costs, which are the dollars and cents you pay, and the other are the intangible costs, which are often far more significant. The direct financial costs are average for open release and endoscopic surgery, and those costs average about $5,300 if the procedure is done in a hospital. Those are broken down into facility, doctor, and anesthesia fees. But if the surgery is performed in an ambulatory center, the costs are about $2,400, primarily because the facility fee is much lower. But do you really need surgery? It's estimated that 92% of people who have surgery actually didn't need it and suffered needlessly. Largely as a result of this, studies show that 52% of people who have carpal tunnel surgery are not satisfied with their results, while the overwhelming majority of people who use non-surgical therapy are quite satisfied with their results. This is extremely important, and you should talk to your doctor about this, because the American Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients should try all non-surgical options before considering surgery. So if you're jumping into surgery because you are told you're a candidate for surgery, you must consider non-surgical options first. Otherwise, you're doing yourself a costly and dangerous disservice. Chief among the non-surgical options is deep tissue massage of your wrist and forearm, because it's nearly 100% effective in getting rid of symptoms of carpal tunnel syndrome, but only if used daily and for 2 to 4 weeks. But this isn't your everyday massage. It requires specific motions over the forearm to drain the fluid inside the carpal tunnel and to break adhesions over the tendons that cause inflammation. But you don't have to visit a therapist every day to get this treatment, because the Carpal RX will do it for you. The Carpal RX automatically produces deep tissue massage, which acts on the tendons, causing them to lose their inflammation. Surgery doesn't address this inflammation, which is why it fails so often, and why the Carpal RX is so successful. It comes with a true 100% guarantee because it targets inflammation. The Carpal RX always had and always will have a 60-day risk-free trial, which means if you're not satisfied for any reason whatsoever, you get a full unconditional refund of all of your money, including return shipping costs. If you suffer from carpal tunnel syndrome or wrist tendonitis, you have nothing to lose by trying this remarkable product. Remember, it's the only product backed with a 100% guarantee to permanently and easily get rid of carpal tunnel syndrome, wrist tendonitis, or repetitive strain injury. Learn more at carpalrx.com.